Hi, dog mums. We're back with another episode of the Natural Dog Mum podcast. Today, we're having a chat with a holistic vet. She has her practice in Adelaide and actually sees clients inside Pet Deli's new wellness studio. Very, very exciting stuff. Her name is Dr. Carolyn Kinghorn, and we're going to be talking today about all things natural pet care and doing a little bit of a deep dive on skin. Perfect timing now that the canola's out and the wind is delivering all the pollen and all the lovely bits and pieces left and right, and all the grass is sprouting up, and we've got itchy, uncomfortable puppies everywhere. So we're going to be having a talk about how these things affect your puppers and what we can do about it, preferably while avoiding medications and chemicals and things that can cause long-term issues. So stick around. Hello, thanks for coming.
Hi, how you going?
Good, 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 good. Lovely to meet you finally.
Yes, you too. Thank you.
Would you like to start us off by giving us a little bit of a background about how you got into the space?
Yeah, sure. It was kind of a natural, seemingly natural progression. I started off when I graduated in 99 and I went into general practice, and it wasn't my jam. It certainly has a space. It just wasn't mine. And I went into emergency and critical care for many years, went back to general practice, and I just got a bit disillusioned with Band-Aid treatments. I want to know why. Why is the animal exhibiting whatever they're exhibiting? Not just skin issues, but whatever, but why? So I decided to do my postgraduate in veterinary acupuncture. So I became an acupuncturist, had great results. I had so many owners asking me to treat them, which I couldn't. So I did my human acupuncture bachelor degree. So I've got degrees in both. And then and nutrition's always been super important with me as being a foundation. And I know we're talking about skin, but nutrition has a huge impact on dogs with skin issues. And my philosophy is always treat from the inside out, not from the outside in. So even though I practice holistic medicine, like you said, to avoid Western medicine, I avoid at all costs. But if they're in an acute phase, I certainly think there's some medications that can be warranted just to help bridge while I get them under control. But
Absolutely.
that's my philosophy, is to treat as naturally as possible to build up an animal's immune system in order to be able to fight whatever allergens is causing their issue, which can be contact, can be seasonal, it can be dietary. Regardless, it's an immune response. So it's about building up their gut health, building up their immunity in order for them to be able to fight the response that they're sensitive to.
Absolutely. So can you give us some examples for those who don't have a dog having these sorts of issues? What sort of problems or what sort of symptoms are pet owners presenting with?
As far as skin goes, that itchiness, obviously. So my first question would be about seasons. Are they chewing their feet? Have they got ear infections? If it's contact, it's generally the feet. So what happens with dogs that is a contact allergy, they'll chew their feet. And guess what? Then you have cross-transference because they're chewing the feet and the bacteria goes around their mouth. So often then they'll rub their face along the ground because then you're getting the same sort of issues around their mouth, and then they'll itch their ears. So then we've got a wet paw from chewing it with all the bacteria, and then they'll scratch their ears, and guess where the bacteria or yeast or wherever it all goes, it goes into their ear. So then you have cross-transference from all those things. So it's about finding the root cause and treating that while treating the branch infections everywhere else. If it's generalized, if they're just itchy all over, then I'm looking probably more environmental, with inhalation allergens, which can be a little bit more tricky, but it's not impossible. So that's because you can't test for everything. We don't know everything that's in the environment. We just don't. So you can't test for it all. There's so many factors out there that we can't test for because we don't know whatever. So that's a very hard one where seasonal things comes in, not walking between 10 a.m. and 4 p.m., which is when the pollen count is high, if it is pollen. But there's so many factors, but I'll always go back into gut. And the one thing with generalized itchiness, when they're quite distressed, is I'll also ask about anxiety, because when a dog or a cat is itchy all the time, and yes, they get exhausted and might sleep during the night for whatever reason, they still need to sleep. But if they are itchy, there's a degree of anxiety that goes with that. If you've ever had hives before, been covered in mozzie bites, you can't tell me that it's not distressing. You're not just like, yeah, whatever. Of course it's distressing. So that affects the nervous system as well, because there's a degree of anxiety. So that then comes into the gut-brain barrier. The adrenal glands get involved with cortisol. Cortisol are released when it's times of distress, affects the gut microbiome. And then you get leaky gut, which tends to be a bit of a term used lately, but is the truth. The microbiome then isn't great, which is the gut bacterial health. So the gut needs to be supported. So when I treat skin dogs, that's what I mean about starting from the inside out. So I go straight and do a formulated diet for each animal. That's an anti-inflammatory diet. I look at each case. You would never get a generic diet plan from me. I look at each animal, and each animal gets it tailored to them to decrease systemic inflammation, fix the microbiome with probiotics and supplements, and decrease the anxiety as well. And it takes about 2 to 4 weeks for it to reach therapeutic effect. And I'm very much on if I can heal with food and basic supplements, I will. I don't like throwing everything at them, because I don't know what it is that has worked.
Exactly.
I choose nutrition first with basic gut probiotics to help the gut heal and decrease inflammation through food. And then I'll tweak it as we go along. So it's a 4-week plan with me. It's certainly not. So my clients will call me and ask questions, and I'm all ears for that, because once they're on my journey with me, my aim is to get the dog or cat better. And that doesn't mean they don't have relapses. Like you spoke about the canola at the moment, there's going to be relapses, and you just have to persevere and not go back to square one, but not be disillusioned either. It's people with hay fever. If they're under stress, you'll have worse years than others. If they're stressed, they're going to have worse symptoms. It's the same with animals. If they might have lost a dog, gained a dog, moved house, and whatever. So their immunity's affected because they're a bit under stress, and so they might have a skin flare up. So it just needs to be managed.
Absolutely. And just like us humans, dogs' immune systems, or roughly 70% of their immune system, very similar to humans, actually lives inside the gut. Something that more pet parents should probably be aware of. That again, as you said, healing from the inside out is super important. But whether it's skin or whether it's any number of different symptoms that they're displaying, gut health is absolutely number one and the first thing that needs to be balanced.
Absolutely, absolutely. It doesn't matter if a client comes in with an animal or their pet for a sore knee, I'll always ask them what their diet is, because everything comes back to nutrition. Regardless if it's skin, arthritis, whatever, it comes back to them getting good nutrition. Absolutely.
Yeah, for sure. I mean, the difference is night and day when you see particularly a dog that's really uncomfortable, really, miserable with these sorts of issues. You start getting the diet right, and yeah, you start noticing the difference pretty quickly.
Absolutely. Absolutely. Yep. Completely agree. You'll have dogs that, they didn't even realize. And it's similar to humans after treating, they say with humans as well, you don't realize. So people with chronic pain, for instance, and let's think about that with animals. When we bring it back to skin that are itchy all the time, you don't really notice the behavior changes until the itch is gone. So what you thought might be your normal pet, suddenly you fix it from the inside out, and then suddenly they're doing zoomings all of a sudden, or more energetic or wanting to play, but you just thought maybe that was just them getting older or whatever, but it's actually them just being exhausted from being itchy and their whole system trying to cope with that, remove that. And it's amazing what changes you can see in their entire behavior and quality of life.
Absolutely. Do you have any recent case studies that jump to mind that you can walk us through? A particular dog or dogs who came in with with these sorts of issues, and what treatments or what supplements, dietary changes you recommended, and what the result was?
Yeah, sure. Like, I've got a lot. Um, but uh, y- okay, yep, I can pick a golden retriever with skin and gut issues actually. So itchy and a bit of like irritable bowel syndrome type issue. So when the dog was under stress, he'd get diarrhea, and only a very young dog. So we're talking about 3. So he's got a lifetime ahead of him. The vet, he was actually referred to me by another vet because they wanted to put him on Western medication to handle his itchiness and his bowels. So 2 separate medications for really the same underlying problem as far as I look at it. But the owners were very adamant that they wanted to try to treat him naturally. And the vets, good on them, they just said, look, I just simply don't have the knowledge, and go and see Carolyn because she does have the knowledge, but I simply don't have the knowledge to recommend it. So I put them on an anti-inflammatory diet. So I'm treating 2 things now. I'm treating the gut and I'm treating the skin. And this dog had been itchy. I call them, they were born itchy. So probably a congenital stress type situation, probably didn't have a good start in life as far as gut. And once you're born, what you are fed straight away is so important, hugely important on setting up your immune system for all of your life. So it doesn't matter what species you are. And so this dog definitely did not have that. So we're talking about wheat bix and milk type of stuff and poor quality puppy dry food. So I transitioned. So these owners really wanted him on a raw diet. That was what they really wanted. So I explained that putting him on a raw diet straight away, probably his gut would not cope with that without actually resetting his gut. So what I did was what I call is a gut reset. So I put him on a gut recovery diet, which also is the same as skin, where they fed him just bone broth And he was fine with chicken. If they wasn't fine with chicken, which isn't really anti-inflammatory, turkey's better. But with him, he was fine on just slow cooked, very not so it doesn't destroy the nutrients in the food. Just sweet potato with skin on, chicken, apple cider vinegar to draw out the minerals from the bone. So there's a bit of calcium in there, just for 5 days. And then I transitioned into a cooked diet, adding in egg yolks or eggs. So eggs contain PEA. So PEA is a big thing at the moment. So PEA is a really strong anti-inflammatory that's produced naturally in humans when there is inflammation. We produce it when there is inflammation, but it also occurs naturally in egg yolks, but not at a huge amount, not at a therapeutic amount. So my anti-inflammatory diet included all of those things. Plus I put him on PEA and a probiotic, prebiotic, enzyme, gut health diet. So an anti-inflammatory diet would involve fish, because obviously omega-3, omega-6s being an anti-inflammatory, lots of greens, anything with inflammation, think green. The proportion of meat to veggies vary on the dog and their energetic output. So I don't have a strict diet. Again, I work on each dog or cat individually. It's exactly the same with humans. I'm not going to prescribe the same diet for a marathon runner than what I would someone who's extremely stagnant and difficult to walk. So there's not just a blanket amount, like it has to be tailored. And we are probably 3 months in now with him, and he is now on a raw food diet, which has been transitioned very slowly. So he's on the recovery diet for 5 days, then on a cooked diet, and then transitioned him from that diet to the same diet from cooked to raw. And he is itchy free. His bowels have been great, except for one episode during a thunderstorm. So
Fair enough.
highly triggered. Yes. So that was the only diarrhea and no itchiness. And the owners are just thrilled at the change in him and how happy he is. His coat's better. I've now weaned him off PEA because the less supplements I can do, the better. When I start off, I don't want them to just be on it forever. I want them to fix themselves with food. So he's off the PEA supplements. I've put him on so the initial probiotics, prebiotics, and enzymes was to restore the gut back to health. Now he's on a very basic one, which I'll probably start to wean him off soon as well. And then I'll start introducing different proteins away from the anti-inflammatory diet, because if his system is now healthy and able to fight it and not under stress all the time, he should be fine. So it's been fantastic. And that's just one of many examples that I can think of the top of my head. That just came to mind because I just spoke to them yesterday.
Amazing. So, talk to us a little bit about the kinds of foods that you would be including in an anti-inflammatory diet. You mentioned that he started on sweet potato and chicken, or for a lot of people, turkey. Once that initial period has passed and the gut has been reset, what sort of foods do you include?
So anti-inflammatory diet is basically oily fish, if they can tolerate it. So oily fish, turkey. You have to balance it up with offal. So offal's a bit hard for some people to get with a variety, but luckily I have the sources to get good anti-inflammatory offal, I would stay away from chicken. I usually recommend duck and goat, and it's only 10% of their diet, the offal. So you're not talking about a massive portion of their food. Um, and then the supplements of PEA, and I also add in eggs into their diet to get natural PEA. Again, anything I can give naturally in their food, the better. With anti-inflammatory, think green, so kale, spinach, broccoli, unless they have an adversity to high calcium foods, which brings it back to another thing altogether. But generally, think green. Sweet potato is good for the gut, but not necessarily anti-inflammatory as such. But I like to put something in there that is very beneficial for gut health, and that is one that can be quite helpful. And then you've got your antioxidants. So berries, providing they're clean and organic and also financially viable. So, blueberries can go from $5.50 a punnet to $14 a punnet in a blink of an eye. So it just has to be affordable. Carrots, they're also got their antioxidant properties, but they have to be organic in order for that to be anything. Generally, fruit I would definitely stay away from because fructose in the fruit can be quite inflammatory. But the one that I will allow, when I say allow, I don't, there's no rule book, but they'll say is okay as a treat are surprisingly apples as a treat. Not a whole apple per 5-kilo dog, just a little bit, because some owners have a difficulty with giving treats because when they put on an anti-inflammatory diet, there's no ends of pieces of toast. There's no ends of the cake. You can't have any of that because it will trigger it straight away. So in order to treat the dog, sometimes you have to also consider the owner's behavior. So you have to placate that so they can give something at the end of the plate. If they're not going to be able to adhere to it, that's not going to be bad for the dog. And they probably don't want to sit there having their breakfast with a sardine on their plate. So, and speaking of that, when I say oily fish, fresh, not canned. So apples have got beta flavonoids in them. And so they are a really strong anti-inflammatory as well. So in some cases, I'll say, okay, well, you can cut up a little bit of apple and have it in the fridge. And if you want to be able to placate that, because let's face it, the dog's not going to pass away because you don't give them a treat at the end of a meal. But nor are they going to hate you, by the way. They're still going to love you forever, even if they don't get something at the end of that plate. But some people have those heartstrings and they're not going to be able to stop it. So I have to treat that entire relationship so it doesn't affect my outcome, if that makes sense. So those are sort of, so those are the main anti-inflammatory foods.
I think that's actually very good advice, even as a general rule, even if you're not looking to reduce inflammation. I'm a very fussy dog mum and very particular about what I let my dogs have. They're on a raw diet. What I tend to do for treats, and they're just as happy, is either fruit, either something like apple or a bit of banana or some squished berries. My guys will even take things like tomato, avocado, as is. The other things I will do if I want to give them a yummy treat is freeze-dried organs, things like that, which are fairly easy to find. They think it's Christmas, but you're giving them something that's good for their tummy as well.
Yeah, absolutely. Which actually just pointed out something that I did not think about, and that is tomatoes. So a lot of people are really scared about tomatoes, but it's actually a really good anti-inflammatory food, and they can tolerate it well as long as they're not sensitive to the salicylic acid in tomatoes. So it's become a a thing that dogs can't eat tomatoes. They absolutely can have tomatoes. It's absolutely not a problem, just like with people, as long as they don't have a reaction with the salicylic acid, and it's not a big deal. I've been working with a pet nutritionist who's got a PhD in pet nutrition, and she does the food. So we've just made up an anti-inflammatory raw diet because there's such a huge demand for it in South Australia, particularly. I don't know what it's like in other states, but we're really dry, so we have a lot of skin issues. And
Victoria
tomatoes
is
is
the
most
same.
pardon.
Victoria is the same.
Yeah, Victoria would be the same, especially where you're based. So tomatoes, that's part of the diet. I mean, even my own dog, she has tomatoes because she doesn't have an adversity to salicylic acid. But yeah, so it's a really good anti-inflammatory food. Just everything has to be done correctly.
Absolutely. For my guys, it's as I said, it's a treat. I have a lot of salads with cherry tomatoes. These guys will literally take a cherry tomato out of my hand, and they absolutely love it. The only things they won't eat unless it's wrapped around meat is we haven't got to salad greens and cucumber yet, which are also good for them. They're not a fan, but yeah, they absolutely love those sorts of things. And avocado, I've been feeding little bits to them for quite a while. A lot of people have
Yeah.
said, but I thought that was toxic and they can't have that and blah blah blah. Well, no, I wouldn't give them the stone and I wouldn't give them the skin, but the flesh is really good for them.
Yeah, absolutely. Yep, absolutely. Same with mushrooms. People are worried about mushrooms. Mushrooms are fine. Absolutely fine. Like really good for the immune system, by the way. But yeah, there's a few, even broccoli that had a bad rap due to one vet that put a report on the internet saying that their dog had an adverse reaction to broccoli. And it was just, he could have just
That
eaten
would be rare though.
something else. It's just not founded at all. And broccoli's fine, absolutely fine. Broccoli, avocado, all of those things that we just talked. Cucumbers, fine as well. That's great, really cooling, anti-inflammatory. I mean, you look at there's a reason why people put cucumbers on red eyes or a tea bag because it's full of anti-inflammatories and not anti-inflammatories, but antioxidants. Like it's great. So yeah, generally, if your dog's drawn to those things, they're telling you something. They're
Very, very
saying, "I
true.
want to cool down." Yeah.
So, so true. So before we finish up, if there's one thing or a couple of things that come into your mind when you're thinking of pet parents generally, and gee, I wish more people knew about this, what would it be?
In relation to skin, the first thing that pops into my head is stop feeding a dog dry food. What you're doing in the long run is creating vet bills because the health will inevitably suffer. And also, this, what I feel sorry about for owners is that they go to the vets and they get recommended these foods. But the thing is, you can't, and they think it's professional advice, and it is professional advice. But what they don't understand is from a veterinary point of view, we have been brainwashed since first year of uni in vet school to do dry food. We get 6 months of nutrition and none of it is about balanced diet. It's just they should have this amount of crude protein, this amount of blah, blah, which makes no sense. Like who sits down and I mean, you and I wouldn't sit down and go, well, today I'm going to have this, which will provide this much crude protein. You simply don't do it. It's common sense to just have a balanced diet over, say, a week. But they just don't have the education. And unless you're very proactive about going out there and educating yourself about veterinary or pet nutrition, you just don't know. So I want owners to be empowered in asking questions and doing their own research, and don't be guilt tripped and do what you feel is right. And I have owners that still want to feed their dogs dry food, and that's I'm not gonna be on the flip side and guilt trip them about that either, but it just makes my job a bit trickier because then I have to support their gut in other ways. I mean, they might have 3 Great Danes, or, it might simply not be viable for them to do a home cooked diet or whatever their lifestyle is, but it just means I support them in other ways. But a homemade diet or getting it is not difficult, and it is not more expensive. Takes a little bit of more time, but at the end of the day, your pet is going to benefit from that greatly health-wise, and your vet bills
Absolutely.
will reflect that.
Oh, definitely. I mean, if you put it into in terms of humans, with human children, you know, you wouldn't feed your kid McDonald's 7 days a week, you know?
No, and
You
that's what I've always said. I've said, if it's so fantastic, then why aren't we eating it? And the thing with dry food, initially when it was formulated by scientists for the war dogs, because they couldn't provide the war dogs with food. So they had a scientist come up with dry food. And when he first did that, he put in his report that no dog should be fed that for longer than 3 months.
mm,
Um, Obviously, since that formula, the formulation has changed a lot, a lot. But at the end of the day, dry food should probably say, rather than saying balance, which it may be, and all these fancy words and pretty packaging, should probably say convenient for owners, not so great for dogs or cats.
very
But I
much
say
so.
that I say that knowing that some owners are doing the absolute best they can. And so I don't want to make anybody that feel guilty about if they're forced into that situation where they can't do anything different. But that's kind of the the base of it, really. And like you said, there's no way we would feed our children dry food, human children, by the way. There's no doctor that would say, well, I think you need to don't feed your don't feed your child like wholesome food that's balanced. Just feed them these microwave meals or McDonald's. Like it just doesn't it's never been I've never quite made sense of it, even since first year vet school many moons ago. It's never made sense because I think in a sense you are sort of what you eat, and if you can fix your gut, you can fix a lot of things, including skin.
Absolutely. Well, thank you so much for coming and chatting with us. It's
Not a problem.
it's been lovely to have you. I can think of a dozen topics off the top of my head, that I'd love to do deep dives on. So we'll definitely have to get you back in the new year and chat some more.
Yeah, definitely. Look forward to it. Thanks for having me.
Fantastic. Absolute pleasure. Now, dog mums and dads, of course, if you're in the Adelaide region and you're looking for a holistic vet, you need to pop down to Pet Deli. Right next door in the same building, you'll find the Pet Deli Wellness Studio, which is where Dr. Carolyn's practice is based. So if you pop into the store or you contact them, you'll be able to make an appointment and get all of the advice, and all of the supplements and products and goodies that you need.
Thank you.
Excellent. And thank you. Been lovely chatting. I could chat for hours, but I'm sure you've got things that you need to get to, as do I. Is that a
Yes,
dog
I've got
panting in the
yeah.
background, I heard?
Yes, because it's nearly feeding time at the zoo, so they start getting a little bit worried that they might lose out a meal, which would never
Yes,
happen. But I'm
it's getting to that time here too.
yeah. Hang on a minute, I'll get you to. There we go. That's Blaze.
Barbara, you're beautiful. Oh, Bobby. Oh, look at that. days. I wish I could still pick mine up, but the lightest is 18.5 kilos.
No, I can't pink Tank up. Tank's 25.
Yeah,
She's a lightweight.
mine are 18, 25 and 30. With my back injury, not going to happen.
No, there's no way. Yeah, no.
No.
All right, Sherry. Well, thank you so much.